morning and welcome to another informative episode of Health Check. It's only on Hope TV where you look and live. Today we talk about that most important thing people say you wear, your smile. And especially in children, because those are the formative ages now, we realize that the issues affecting children are the same ones that affect adults. Just that, as children, you can be able to change and make these adjustments early enough. And so are you paying close attention to your children's teeth? With us is, I'll call him our resident dentist, Dr. Elvis Mutai, dental surgeon. Karibu sana.
Asante.
How have you been?
Been well. How are you?
I'm happy. I'm quite happy. I'm happy. I know we have some things to catch up on. I had a couple of visits to him, and then I just broke off our relationship. I'm sorry.
Quietly
ghosted you. Blue ticks.
Exactly.
No, but the one thing I really love about your space, and I'll give you a minute just to talk about it, is the efficiency. There's no waiting time. Your appointment time is, you get into your appointment. I don't know how you managed to do it, but just not keep anyone waiting. So it was very COVID safe. And of course, just the detail that you do, because apparently he doubles up as a photographer. So he has all these photos of every side of my jaw somewhere in his office. Just introduce yourself and where it is you practice.
My name is, as you said, Dr. Elvis Mutai. I practice at Yaya Center, that is in Hurlingham, or is it Kilimani? I think Kilimani. Smile Studio Dental Clinic, that's on the 3rd floor. I, by profession, trained as a dentist, then went on to further my training in photography, as well as...
Wait, I was joking. Okay.
As well as what we call orthodontics, or braces for that matter.
Orthodontics.
Yes.
Okay, let's talk about the traffic from Yaya coming here.
Horrible.
I know,
horrible.
Right? What's going on though?
2 kilometers, but it is just...
What is going on with our roads? That's another whole conversation for another different show. But I'm glad you made it, and we are starting on time. This conversation will be also really centered on your questions. So be sure to send them in on 22232. That's 22232. You can comment if you're watching us on Facebook or on YouTube. I'll be checking out your comments as we proceed. I think we should do a whole dental class because people have forgotten. Can we start from the teeth we have as children? What are they called?
Milk teeth, or deciduous dentition.
And how many are they?
There are 20.
20. So 10 on top, 10 down.
10 bottom, yes.
Okay. And then what is that process between, because you just start seeing 6-year-olds, Anna Mapengo na Joy, 6, 7, 8,
Yeah.
Is it actually at 6 years that babies...
No, you see, like, it varies from child to child, and also gender. If you are, mostly we see girls having their teeth coming off sooner than boys. And that's,
girls sit before boys, and then guys are like, oh, gender equality.
Exactly.
Anyway.
Yeah, so there are those disparities that arise between the genders. And then we have also the early maturers. There are those ones who even shed teeth as early as 4, and they have a whole set of permanent teeth by 10. And the others who we see even the permanent teeth the milk teeth as late as even 14 years.
Wow.
My dad had his last milk tooth removed when he was 50.
What?
Yeah, exactly. So there are those things that,
What?
So sometimes they just get stuck in the bone. So there's things we expect, and there are things that happen.
I'm curious to know, his son is a dentist. How did you know that's a milk tooth? Because you were not there in his whole process. I'm sure at some point you were in school for like a year, what. How did you know that's a milk tooth?
Well, with them, they consult me for everything.
Okay.
It's because, daktari.
Yeah,
so everyone calls.
Daktari.
Then I once saw a few of his teeth that required attention, so I took him to a dentist that I recommended.
Okay.
And I was there with him through the process.
Yes.
So we were able to go through the diagnosis, the discussion, and everything. And then I was told a couple of milk teeth I didn't examine.
Yeah.
At the time, I was a student, but at least I knew what a milk tooth looked like. And then, that's how I came to know that he has a milk tooth.
I think we jumped the gun a bit. Let me start with, at what age do we see teeth starting to come out? And when should parents be concerned that mtoto wangu bado kona mapengo na ako this age?
I wouldn't say there's a limit, because some teeth have come out as late as even the 4 years. So when we're expecting them to be removed, there are still no teeth in the mouth, or there are very few teeth in the mouth. So when we're talking about ideals, when you have the 2 curves that you have on those child certificates that you go with to your pediatrician for your vaccines, we see them starting coming out at about 4.5. Then there are those ones, of course, that will be below the curve, that will not show it at 4.5, will come at 6 months. I'm talking about months here, right? So about 6 months.
Yeah, because everyone was like,
Yeah, so I'm talking about months.
Oh, they're so cute though.
Exactly. So at about 4.5 months to 6 months, that's when you start seeing teeth coming out. And then that's the first set on the lower jaw. And then you give them a few more months. That's about month 12. You see the top ones as well coming through. And that's when they're starting to walk and holding themselves around, whatnot. So sometimes you even see the complement, the 4 of them, top and bottom, front 4.
Yeah.
And then we have the first molars coming out at about the 13 to whatever month, 14 months. And then they proceed on and on until the last one comes out at the month 30. Then they stay like that for up until 4.5 years.
Okay.
Then at 4.5 years, then you start losing the lower ones in the same order that actually they came. That's exactly the same order that. So the lower ones will go, the bottom 2, then the top 2. Sometimes even the bottom 4 first before any at the top, and then the top, middle 2, then the side, then we go to the molars at the same time are growing. So you don't lose the milk tooth molars first, but the permanent molar comes before you lose them. So you'll have a permanent molar behind, and that's where people confuse and say, I don't remember removing those back ones, right? But those ones are now coming off at the age of 13 or thereabouts.
Yes.
So, but that's what I was saying, within the curve. So that's where we have teeth coming out, the last tooth coming out at about the age of 13. But as I've said, there are those ones now that go above the curve and have a full set of permanent teeth, plus the second molars at even the age of 10.
Wow.
Yeah,
so it really just varies.
It
But
does.
at least we have a direction as we talk about that.
Yeah.
So in the 10 teeth that our children have by the time, in that age, before they start falling off and all that,
Yes.
what teeth do you expect? Because they are different teeth. Like they are incisors, molars. What should we look out for in the mouth of our children?
So they're 20, not 10.
They're 20. Oh, sorry, 10, 20.
Yes, 10, 10.
Say 20.
So they're 20. So at the top and the bottom, it's exactly the same complement.
Okay.
So it's 4 incisors, 2 canines, and 2 molars. So that's the complement of 10.
Okay.
So there are no premolars in kids.
No.
Yeah. So the premolars are the ones that are going to replace the milk tooth molars.
Okay.
But the permanent molars come behind
Yes.
the milk tooth molars.
Okay.
Yeah.
That's really good to know, at least for our children. I think I'll start with my own example. I felt really harassed with these teeth shaking and coming off. And
Yeah.
I remember these ones refused to come out and I had to be taken to a dentist to remove them. And they took so long to grow. Then I was being told it's because you went to remove them at a dentist. So that's why is that a myth or is a real thing?
No, it's a real thing.
Yeah.
Because you see, sometimes when you're having to take a child to a dentist to have a tooth removed, then you might find that the one that is to come in is either too far back or too far forward, that it just, or they just missed each other. So now that you've removed it, it might actually grow immediately after, but in a wrong position, then autocorrects itself because now there's space. And that's the beauty about treating kids, because there's a lot of that growth potential that helps you autocorrect a lot of the mistakes that are happening. Sometimes you might be going to the dentist to remove a tooth that is broken, or you fell and then the tooth needed to be pulled out because it was too loose.
Yeah.
Of course, if that happens, then you're removing a tooth before its time. And that will give you a longer wait period before you start seeing the permanent teeth. And that's where parents start getting worried and say, where is that tooth?
Mapengo.
Mapengo. Exactly.
It's
So
dangerous.
if you're removing a tooth in a child and before the time of removal, then definitely just be patient.
Okay.
I mean, get the reassurance from your dentist as to why it is. Sometimes we even give them the option of having an X-ray done, but most of the time we'll assume that you're normal and give you the timelines. If you're below, then we give you a waiting period. If you're above, then you're like, okay, let's take an X-ray just to affirm that tooth is there.
Let's talk to parents and just assure them that they can come even though they don't have a problem for a consultation.
It's always good, actually,
Yes.
because I like seeing kids as early as there's a tooth in the mouth, because then I pick up growth patterns that might be going off,
Yes.
and then help correct early. Because remember, if you're correcting a growing child, that correction will be sustained throughout life.
Wow.
As opposed to meeting an adult who has had all these errors that have been developing and have been in the mouth after growth is complete, and then you're struggling to correct a fully formed adult. as opposed to a child who's growing.
Yeah.
A child who's growing is always better, and even the treatment outcomes are superior and always pleasing to the parents to see. And even then, cooperation is better. When a kid comes in for treatment, they'll come because they're being brought to the dentist. For an adult, you have to find time off work, you have to get tired of me at some point. As the minute I put your braces or anything, you start asking me when are they coming off.
I know.
Yeah. For kids, they're happy.
Yeah.
Some of them even stay with braces wrongfully though,
Yeah.
for as long as even 7 years.
Wow.
And you know, they'll keep an adult staying with braces for 7 years.
No. It's a case.
Yeah.
It's a case.
By month 6, they're like,
is there an option of removing the whole jaw and just putting another one?
correct.
We're having a conversation on teeth and especially looking at children. And actually, the oral hygiene is actually the part we're going to, oral health as well. Let's explain now, what is oral health?
Oral health, of course, is when you have, there's a good balance of, you know, your bite, there's, you know, healthy mouth and gums, there's teeth that are in the mouth that are healthy, so we don't have any disease process that is present. We have good hygiene and you're able to maintain that hygiene without any challenges. That is what I'd consider oral health. So there's function, there's aesthetic, there's also, you know, the whole element of speech, because that is a part of your oral cavity.
That's a big deal, actually. How people speak is actually really affected by their dental.
Correct.
Yeah, even how I speak, actually.
Yeah, there's the dental and also there's also the surrounding structure.
The surrounding structures.
Yeah.
Okay.
Like
As you talk about, as you talk about that, you've mentioned, you know, the way it looks. You've talked about the gum. Can you just give people examples of what is problematic? Because I realize people don't know. Like, I meet people who have like sore gums that are just crying for help.
Yes.
And they have no idea. So could you just explain what unhealthy looks like?
Unhealthy, well, if you're talking about the black or the African population, where we have the melanin that is, you know, presently rich in us, then the color of the gums will vary from pink to a dark shade, right? And there's a part where it will be completely pink as well. So if you see that dark shade and then you see the pink, super. Sometimes you might, now when you see it becoming unhealthy, one, there'll be spontaneous bleeding. You'll be biting onto something that is white, say a banana or a piece of bread or sugar cane, and then you see spotting of blood there. That is a problem. That is a disease process that is ongoing.
And even if you brush.
Yeah, and even when you brush and you spit in the sink, that can happen. And sometimes even in kids, because there's some children in remote places, but then you have to work hard in kids for you to see bleeding gums. Because sometimes, unless it's a disease process that is now manifesting with bleeding gums, but for kids, if you just don't do the oral hygiene right and you just keep them off the toothbrush and you're telling me they're bugging you, they don't want to brush their teeth, among other things, then it's just a matter of time. And then you'll start seeing those bleeding gums. And then you'll start losing the dark part of the gum and turning it into a red color, not a pink color anymore. That's a disease process. If you start seeing that your teeth are appearing longer than they should or than they were before, that's a disease process. If you're starting to see that your tooth is shaking, and if it's in a child, it's premature, and if it's in an adult, of course, it's a permanent tooth that is shaking. That's a disease process. Bad breath, that's another disease process that you should also be mindful of and bring them to the dentist for the same management. So those are the areas where you can say that is the abnormal, and that's what you should look out for. Yeah.
I saw someone post today on Instagram that his deal breaker is bad breath. So let's just take 1 second to talk about that. There's different causes of bad breath, even as we get into this conversation, even for children.
Yeah.
A parent told me that they know their child has a homa with the child's breath. Like
that is correct, because you see, for kids, when they're young, they still have active tonsils. So sometimes when they get those colds and basically a dip in immunity, their tonsils flare up. So with tonsils flaring up, they pack food longer than they would normally when they're just not having any disease process ongoing. So with those pockets, they're not able to reach with their toothbrush no matter how well they do it.
Oh, no.
So now that's when the sore throats are developed thereafter. That's when now you start developing the bad breath in those kids, and that's how you know that there's a cold or a flu that is
I
ongoing.
didn't know that's a process. Interesting.
Yeah, so that's where you're getting the bad breath from.
Yeah.
And now in adults it's a problem because some of them have sustained enlarged tonsils throughout life. So those ones keep packing food and then they're not able to clean properly. and therefore they're suffering consistent bad breath.
Because you can't floss the tonsils.
They can't, exactly. So they can't
Of course
floss.
not.
So sometimes we ask them, of course, see the ENT, have them removed. You'll have a better quality of life.
Yeah.
You can't really clean them with your gargling, looking up and pouring, dousing it with mouthwash and whatnot, or chewing gum throughout the day. Yeah, sometimes they just don't respond.
It's a problem.
It's a problem, yeah.
As you talk about that, children and flossing. Is that a thing?
It is a thing. Of course,
And
getting
even adults. Please talk to adults. Kenyans don't floss.
not adults just all over.
Humans.
It's not even just Kenyans.
I saw someone like this because I floss. They're like, oh, wait, so, and my teeth are so tight, like literally. I have to floss. Like if I don't floss, I'll just play this all day.
They're packing food, right?
Yeah.
Yeah, but then it's just an adult. I think flossing is a habit that is not very. I think it's a lot of time.
We're not taught, I was not taught flossing growing up. And I think I went to some pretty decent
Schools,
places.
right? But then you were at the age of grids. People are pushing.
Yeah, we did have flossing. It was just to brush your teeth.
Yeah, brush
I wake
your
up in
teeth.
the morning, I wash my face, I brush my teeth,
Yeah.
I floss. There's no part like that in that
Yeah,
song.
because flossing is mostly taught. You're right. It's
Yeah.
mostly taught at the clinic.
Yes.
Hardly do you find programs where we have mass teaching of flossing.
Yeah.
At that point in time, we just want, by the way, brush your teeth.
Yeah.
Yes, just pack those teeth with fluoride toothpaste.
For someone who's wondering, flossing si kuoneshana, like floss, like flossing. It's like there's different. You know what? Catch our last episode that we did with Dr. Elvis. It's on YouTube. Go watch it. He even came with like
the string floss.
he came with like 4 types of things that you could floss and clean those parts that your toothbrush can't get to.
Correct.
So please check out that episode. I'm so serious. This is homework for you so that you can get to know what to do and even how to do it. He even talked about how to brush like in circles and so please catch up on that.
And as an addition, there's now new tech that is helping guys even enjoy the process of flossing called a water flosser. I can't emphasize enough. Use a water flosser. It's
much is
quicker.
it?
I mean, it's
Me, I'm asking how it's
it's expensive. That's for
Expensive is
sure.
how much?
Yeah, like I've seen locally guys retailing at about 16,000. But if you have someone who's traveling in from, say, the States, Dubai, among other outside countries, they're as cheap as 4K.
Wow.
And they're really good.
Water flosser.
Yeah, water flosser. And they have batteries that you just recharge, and then there's a jet of water that cleans in between your teeth just as well, if not even better.
Can I order on Amazon? Or something?
Yeah, you can.
Yeah.
For sure.
Okay.
Yeah.
Guys, let's get water flossers.
Please
let's
do.
save fast. I was joking at him, we are rich so that he saves the price. As we think about that, as baby, I think we've talked about what age and how they develop and the signs and symptoms of teething problem. We've talked about, so when a parent gets to 4 years, mtoto ana meno, they come see you?
Yeah, come see.
For 4.5.
Let's just see them throughout the development. Don't wait for problems. I insist on that because I really want to see them when they're developing. Because when I see kids, they will come to the dentist with the assumption that they only have teething problems they need to deal with. But sometimes I'll tell them if a child is grinding in their sleep, that's not right. That's something that needs attention. And I will see the signs of grinding because the teeth will have wear on them that is premature. I will see things like kids who are mouth breathing right from the reception even before they come in. I'll see the restless kids that are just all over the place, and we will pick it up that they're probably having disturbed sleep, and we will talk to them about that, among other things. So it's not just a teething issue that you should bring your child to the dentist for. You should bring your child to the dentist for us to monitor growth and development, because there are those early signs that we will need to correct at that particular age.
Absolutely. You need to monitor the growth and development. Okay, so we've told our children brush. What can parents do for the care of their primary teeth?
Care of primary teeth, of course, that pure oral hygiene that is consistent. Emphasize it and emphasize it over and over again. Bring them in every 6 months so that we can polish them in the clinic as well, because of how difficult it is for them to coordinate their hand in the mouth while brushing their teeth at that age.
So as a young child, you can form tartar?
Yeah, not tartar per se, but if you really hang on to the dirty teeth, yes, they will eventually form tartar with difficulty though. But compared to adults, for example. But then if you have a child that is brushing at least twice a day, that as recommended, or even 3 times, because they're home during lunchtime, most of them. So brush them even 3 times. It's encouraged, by the way. The more you brush, the better. You can't be as efficient. So brush those teeth. Then bring them in every 6 months or so just to have a check and see how they're growing and developing. We'll also polish those teeth to make sure that now we're enhancing what you're doing at home. if you can manage to get a child to floss, please do. And there are those things that are being sold, the flossers that have a handle.
Yes.
Yes. It's like...
it's in that episode, we carried one.
Yeah.
It's like a toothpick, but with like a
bow.
part,
Yes.
a bow. It actually looks like a bow with a stick.
That's the thing.
Yeah.
So if you can use that now to clean in between the child's teeth, super. Most of children's teeth have spacing in between, and the spacing is good because we want the permanent teeth to fit in.
And most people with good breath have spacing in between.
Not necessarily.
Really?
Yes, but we want...
I've been doing research.
With adult teeth, well, you're right in the sense whereby the spaces allow for self-cleansing to happen better than now, say, maybe tight teeth. But tight teeth are better because they don't allow food to get packed in to begin with.
Oh.
So you see, there's an advantage to both sides.
Never
But
thought about it.
we will have the spacing, people now being, using toothpicks more than those ones that have tight teeth, right? But in kids, we have spacing in between the teeth most of the time. So brushing sometimes tends to be more sufficient for them because of that spacing. So it allows for self-cleansing to happen on the regular. But if you have tight teeth, then try and get the floss in between. Because some kids have very small jaws, and that packed teeth problem now will require you to floss them.
Absolutely, or support them to do it. As we talk about that, fluoride, it's like, it literally writes, can cause death. So how safe are children using fluoride, and how can we train them?
In this part of the world, we have a lot of fluoride in our water, and it's a problem actually right now because borehole is popular. Water supply has not managed to do the treatment and eliminate the fluoride in the water to allow kids to develop without fluorosis.
Oh, no.
It's a more common issue than we used to see before, where it was localized to particular areas. If we hear you're from Gong, I expect fluorosis. Kikuyu, I expect fluorosis. And other parts of this town or country.
Or if you grew up in a barracks.
Yeah, exactly.
Why.
Yeah, and there are those people of the barracks, and that's because of the borehole water in the barracks. And there are those people who even are coming from Mombasa, Baringo area, Nakuru. They all have fluoride in their water because they're using hard water.
But someone who doesn't understand, sorry, sometimes I love teeth. This was my dream career, so that's why I like knowing almost everything. So let's explain what fluorosis is for someone who's just watching.
Fluorosis is when you have the element fluoride replacing calcium in your teeth. So now you have something called calcium hydroxyapatite, that is a normal one, but then you have them being replaced by fluoride hydroxyapatite. Now when that happens, then now you have the browning that you see most people having, or the really bright white teeth that are appearing like milky white. Yeah, so it's not the natural nice white of teeth, but now the milky white one. So those are they vary from mild to severe, where
They also look like weak.
Yes, so now the really severe ones will actually weaken the teeth. So you find the teeth are sort of like flaky. So you chew on something or use your teeth normally, but you find that now they don't have the smooth appearance. They tend to become roughened. And that's what you're saying in terms of weak appearance. So they're easily getting decay. They're easily getting the teeth just breaking down whenever they're eating or doing something. So with those ones now, it's a whole other regimen of management. Sensitivity is a big problem with them, right? So the color will also happen. They tend to attract that quicker. So you find they'll need to be cleaning regularly at the dentist, and they can't really do it properly at home because it's a rough surface. A rough surface is always going to attract food packing, right? Yeah, so that's what fluorosis is essentially. Yeah.
Wow. And so wait, in the toothpaste, what is that chemical that it says can cause death? In terms of when you're making your children brush their teeth by themselves and you're like, don't swallow.
Yeah.
Like you can't explain enough, because even this bubble gum toothpaste that I used up to, I think even 2-3 years ago, I loved it. I was addicted to Colgate. They have a, shameless marketing. They have not paid. This is not a paid ad. But they have this bubble gum tasting. So you're tempted to swallow.
Yes.
How do you encourage your children not to swallow toothpaste? And what is the effect of actually swallowing toothpaste?
I mean, you really need to swallow a lot of toothpaste for it to be a problem.
Okay, a lot.
I use a really lot. But what we encourage parents to do is that, you see, there are certain ages of kids that explaining to them rinsing and spitting is difficult. Because all they've been doing is drinking, swallowing. Whatever that goes into the mouth is going down. So that's why they're eating soap. That's why they're doing all these things. So they'll only spit out the food,
Yeah.
then everything
When
else.
they don't like it.
So they don't like
Yeah.
it, yes, but everything else. But you can't explain that to them. So don't use toothpaste in those cases. Warm water and salt mixture is good enough to do the brushing at that age, because then if they're swallowing the salt and water, that's fine.
Yeah.
That's what you put in the food
Yeah.
anyway. Then you get to an age where now you can understand. A child can understand to spit.
Yeah.
At that age, you can start with a pea-sized toothpaste, the child-friendly ones that have really reduced fluoride content, even sometimes nil, right? But in this part of the world, even if you're evading the fluoride in the toothpaste, you're getting a lot more in the water that is now manifesting as fluorosis. So if you're swallowing all those liters of water, you're cooking with the same water, among other things, you're already doing the ingestion of fluoride. So now in the toothpaste, that's an isolated moment where you just have a small dot there that sometimes doesn't have much compared to what you're drinking. Yeah. So I encourage parents that at the age where they are not able to spit, don't use toothpaste.
Salty water.
Yeah, it's a
Warm,
mechanical
salty
action.
water.
It's actually the mechanical action of brushing that removes the dirt. The
Yeah.
fluoride toothpaste will most likely add the freshness, and then will have the soapy effect that will help you clean even better.
Yeah.
Right? So
Yeah.
you can't use soap to clean your mouth,
Yeah.
right? So
Guys,
those some
don't.
people, yeah, some people do it though. But then at that early age, no, just keep the brushing. That's why I was telling people that in certain communities, like the Muslims early on use mswaki.
Yes.
And mswaki doesn't have toothpaste, but they're very good oral hygiene.
Absolutely.
Yeah, because they're just
and
busy.
even the Ma people, they
Yeah.
go sick or something.
Yeah,
it's really
that's
good.
just a mechanical effect of using that stick to clean.
Yeah.
That helps keep those teeth clean and decay free and gum disease free. They don't have any toothpaste attached to it. So that's the same logic you should transfer now to the children at that age.
Absolutely.
Yeah.
We'll be going on a break shortly. I'm taking all your questions. When we're back, we'll even pick up all your calls if you have questions on oral hygiene generally. He loves to see children, but he also sees adults. That's Dr. Elvis K. Mutai. He is at Smile Studio. That's at Yaya Center. So you can visit him on 3rd floor. You can call. Do you have your
Yeah.
line that can call? Yeah, you can share it.
That's 0711 279 035. So that's
0711 279 035. Awesome. Okay, as we do that, we'll be right back after you answer me this question. Why do people have, and I think it's just hit me, why probably I've never gotten like cavities or those dark parts, or because teeth doesn't have a chance to get in and stay in a hole for a while and then get all those germs and stuff that makes it start eating into my tooth. That's the easiest way I can explain it in layman's language.
very well explained.
Which becomes what?
The cavity.
Cavity and
Yeah.
stuff like that.
Yeah.
That's quite interesting.
Yes.
Can you use the medical terms kidogo on how people get cavities and just have holes in their mouth, left, right, and center? After I listened to it, I was like, that is so gross. By the time that happens, what have you been doing? I'm sorry to judge human beings, but just explain it to people who have a chance right now to save their souls.
Well, for a cavity to happen, you need a tooth. You need food or sugar in this sense, or food that is sugary, or sometimes, there's that food, anyway. Basically,
Sugars, there are sugars,
yeah,
yes.
various types of
Yes,
sugars.
sir.
You need time, and then you need the right bacteria to do that.
The right bacteria.
The right bacteria. So if your mouth is loaded with the right bacteria and you have all those other factors consistent with that, then you're definitely going to have the cavity formation. So what you need to do is disrupt that process time and time again, because you give them like 2 hours, they have started the process. So the minute you bombard them with now your toothbrushing and oral hygiene, you stop the process.
Yeah.
Because otherwise the bacteria will now produce acid byproducts from when they're eating the food or the sugary foods that you have in the mouth. They produce the acid byproducts.
Those monsters.
Yeah. And
Yeah.
then you see, when they produce so the acid now is what is eating away at your enamel.
Yeah.
Enamel is the hardest substance in the
And they managed
in
to
the
do
body.
Is there like someone who's taken time to do like a video of this process happening? That would be so cool.
It
to
would
see.
be.
Like,
I'm yet to see one though. It would be.
Why don't you produce one and sell it?
there's sell it to you.
you're not a filmmaker.
All right.
Uh-huh.
Yeah, but there are those schematics that have been made to demonstrate, and they're on YouTube and other places.
Yeah.
So they're just schematics, but not the actual process of breakdown. Because that one now you'll see a lot of dashes moving, dots moving, so it might not be so clear. But the schematics will show. So there'll be the acid acid byproducts, the bacteria gets in, and they're actually targeting to get down to your nerves where there's going to be more food for them.
Ouch.
And attack your body immune system. Because the tooth is the safest place for the bacteria to hide. Because once they kill the nerve system and the blood system basically your immune system has no access to them. So they have time to multiply, attack. Your body attacks back, they move in. Multiply, attack. So they keep doing that.
I'm imagining the army general. He's like, attack!
Exactly. So they keep doing that. Retreat when they're doing
Toothpaste, mouthwash.
Yeah. So they hide in the tooth. That's why we have the root canal treatment done. So they hide in that root canal area.
Guys, it's serious. It's so serious, and you have so much control over these processes. Salty water, what does that do for us?
Warm salty water, of course, it just helps with the scrubbing effect.
Yes.
Because salt is a bit rough.
Yeah.
So now add that on your toothbrush, and with your toothbrush and you're cleaning your teeth, it will help you clean better.
Okay.
Yeah. So that's why I'm saying warm salty water would work very well.
Let's keep doing that, especially for our children. Let's train them. We'll be right back. You're watching Health Check. It's on Hope TV, where you look and live. My name is Kerry Kagiri. I'm hanging out with the Smile Doctor from the Smile Studio. He's also a cyclist, but they almost ran him over. I'm sorry.
Yes.
I have said I'm sorry. Yeah,
Thank you. I accept your apology.
Thank you on air. But kando umekata. Awesome. We'll see you shortly. Remember, your questions on 22232. We'll be picking up your calls as well after this break. Thank you for watching Health Check.
Every time, every single minute, there's something new to talk about.
The government continues to make sustained investments.
And we want to completely support and thank our healthcare workers.
Crime rate has dropped drastically.
We are intentional to inform you on stories happening far and wide across the globe from places never imagined.
We shape national discussion as we give you all the perspective to enhance, develop, and better our leadership, right from the national leadership to the tiniest point of administration.
Business remains the engine that makes the world go round. At Hope TV Newswatch, we strive to bring you the market trends as we focus on strategies that make you and your business afloat.
We pay attention, we listen, we observe, we feel, we margin, and we report. From cities all the way to the common Monanchi, we focus on all you need to know.
Here we traverse the countries to bring you the latest in the world of sports, from scores, fixtures, and breaking news as and when it happens across the globe.
For Hope TV Newswatch, now you know.
De Beneficius Messiah. That's the nickname of Psalm 117 when the author says, "Praise the Lord and laud him." Why should we praise the Lord? The Jewish doctors tell us that that chapter was written to be a benefit of the Christos and the coming Mashiach. And indeed, Paul referred to Jesus in 1 Timothy 6:2 as the benefit. John 4:10 refers to Jesus as the gift of God. Haggai refers to Jesus, the coming Messiah, as the desire of all nations. And Luke 2 refers to Jesus as being great tidings of joy to all people. So too, I want to encourage you that the Christ dimension can live through you so that you no longer live, but now you have the gift, the benefit, the desire of all nations, and the glad tidings of great joy manifested through you when you simply put your faith and trust in the Father who sent his Son to image him to the world. By faith, the Christ dimension will be manifested through you too.
Welcome back to Health Check on Hope TV. It's where you look and live. Today's conversation is on our oral health. That's the word. oral health.
Oral health, yes.
Yes, and we're getting to learn more about how to take care of our mouth, how to take care of our teeth, and the effects it has in our body. There's something you talked about on actually the place that bacteria can actually hide the best, being our mouth.
In your teeth.
In your teeth.
In those cavities.
In those cavities.
Yes.
It's dangerous. I'm hanging out with Dr. Elvis Mutai, and you can just introduce yourself. The people who have just started watching, can you tell them where you practice? And also, I like the orthodontics part that you put in. Quite bougie.
Oh, really? My name is Dr. Elvis Mutai. I am a dentist practicing at Yaya Center, 3rd floor. The clinic is called Smile Studio, dental practice, Suite 10, as they say. Dental degree was my first undergraduate degree. Then I specialized in orthodontics.
But still, to do dentistry, you do medicine, so you can still.
Yeah, we share common classes in the first 2 years.
Oh, the first 2 years.
Yeah, then after the first 2 years, we now specialize in dentistry.
Okay.
Yeah,
that's
so we are
quite
a specialization to begin with.
Okay, you're.
Before we specialize.
This is why this was my dream career. Chemistry, chemistry, mathematics. Anyway, congratulations to all the KCSE candidates who have finished school. I want to encourage you just for a minute. I'm sorry I digress, but I think this is an important time to just tell you whatever grades you got, God will still achieve the purpose He has set out for you, and have a clean mouth.
Above all.
Above all else. As we talk about that, one is asking, my son is 6 years going to 7 and his primary teeth has not started to fall. Is that normal? We spoke about this, but just respond to this parent. My son is 6 years going to 7 and his primary teeth has not or have not started to fall. Is that normal? This is on our text line 22232. Go ahead and text us, and also we'll be picking your calls. Call line is right here.
Yeah, it is normal, especially since it's male. Yeah, they tend to delay a bit. So not to worry, they will finally fall off. So sometimes they can even go as late as even 9 years. So it's not to worry. But come in, let's see how it's developing.
Awesome.
Once we see how it's developing, we can even affirm whether they are going to fall off or if something is going wrong. We will even give you ways to intervene.
Absolutely. As we started this episode, we talked about the importance of starting the dental process with your children as early as now. Even though you think everything is normal, just walk into your dentist that you can be able to access and get them checked, get them treated, get them seen. Very, very important. Brian telling us where he's watching us from Kasarani area. Asante sana. Thank you for letting us know you are watching. Keep messaging. Keep your questions coming. As I go back to your questions, we talked about chronic bad breath, but in children, I don't think we finished that. We talked about the tonsils that can cause that. What else can cause chronic bad breath in children?
I mean, generally with them, they have the adenoids and the tonsils that are really...
The adenoids, yes.
Yeah, they're still big. So those ones can also pack food. The other bad breath cause for them would be poor oral hygiene. Primarily in kids, actually, poor oral hygiene would cause a bad breath. So they sleep with milk in the mouth, sometimes a milk bottle, then the milk is staying there for a bit too long, and then they're not brushing very well. They have a parent who's maybe too busy or a caregiver who's not able to manage their oral hygiene very well. Then you'll see bad breath in them. But with them, they respond very quickly to oral hygiene. If you pick it up nicely, that sorts it out mostly. Unless now we need an ENT to go remove the tonsils because of that inflammation. After that, they'll be fine.
Let's talk about the gap between the teeth falling out and the permanent teeth coming in. What should that look like?
I mean, when they're falling out, you basically have a gum pad again, where you started off before the teeth came in.
And where you'll end up when you're completely old.
If you have gum disease, teeth are meant to last a lifetime.
Forever and ever and ever?
Yeah.
Like, wait, I can be 120 with all my teeth?
Yes, with a complete set. It happens. It
Wow.
happens. There are guys who really take good care of their teeth. Visit your dentist regularly and you'll have those teeth for a lifetime.
Are the people who take mursik? Are those the people you want to talk about?
Possibly. There's advantages to that.
Okay.
To that milk.
Yes.
Yeah, but yeah. So if you have your child's tooth falling out, you just give it a few weeks and you'll start seeing the permanent one coming in. And when the permanent one, if the tooth is naturally falling out and we're following the ideal curve, so you'll have the milk one shaking up to a certain level that you should be able to remove yourself at home, unless you're the parent who really doesn't want to do it.
Actually, can you just pause? We pick this call because just pause. Like, don't lose the train of thought.
All right, go ahead.
Thank you for calling Health Check. Who are we talking to? Hello. Thank you for calling Health Check.
Pardon?
How are you?
I'm fine.
What's your name and where are you calling from?
My name is Cynthia from Karatina.
Ah, Karat. Hi. Okay, what's your question?
I wanted to ask.
Yes.
By the way, I finished Form 5.
Congratulations.
Yeah.
Awesome. Good job.
And I scored a B minus. I also wanted to do something to do with dentistry, but now you see, now I failed in biology. I got a C plus, so you see, I have to maybe retrieve and then look for another course, but still in medicine.
Awesome. Congratulations.
Yes, thank you.
I
wanted to ask, what about hizi meno zinakuanga zimepanguka? What happened? That tumor that is put. Is it possible for you to be put even at an older age?
Ni chuma gani hiyo? Anasema zenye zimepanguka.
Then you need the dent. Is it what is it?
The braces.
I'm trying to remember the name.
Braces.
Braces. Yeah, braces. Is it possible for you to be put even when you are older?
Absolutely. Let's talk about that right now. Thanks for asking the question. Congratulations. And also, Dr. comment on how she can be able to get, because I'm sure there's some courses she can do and eventually get. Sawa.
All right, Cynthia, can I answer?
Yes, sir.
Yeah. Cynthia, there's if you log on to the Kenya Medical and Dental Practitioners Council website, there are requirements that are listed there for the subjects that you need for you to advance into a degree in medicine or pharmacy, nursing, among other medical courses. So just check there and you'll find that information that will help you now make a decision on the way forward. But congratulations, you did very well and we wish you well. And in terms of the age limit, there really is none. Are there teeth in the mouth? Do you want them straightened? Let's do it.
Absolutely.
Yeah.
Anasema zimepanguka. That's such a sad word.
Tutapangisha.
Zitapangwa.
Zitapangwa.
If you, zitapangwa. Do you know any specialists in Karatina?
I'll have to check for her.
Okay.
And maybe we can share it on your website. But,
awesome.
But they're there.
Okay.
Yeah, they're there.
Absolutely. You can visit.
I
remember actually, some of my teeth, I think it's this one and this one, they were removed in Karatina.
Oh, really?
My grandmother had to take me
to a dentist.
To a dentist in Karatina.
Yeah,
it was so sweet.
With all these county developments,
absolutely,
labor is also moving.
Absolutely. Yeah. Keep your questions coming and thank you for engaging with us. Our call line is right on the screen. I could read it out to you. You can call us on 0748 058 261 or call us on 0754 780 382. Go ahead and call us. We look forward to hearing from you. As we continue with this conversation, Dr. you were talking about
teeth falling out. And the gap between that. So I was saying now, if you have a naturally removed tooth, by that I mean even the kid sometimes removes it when they're eating, or a caregiver can remove it.
You find it in your spoon.
Yeah, you find it in your spoon. You wake up in the morning and you're spitting it out sometimes. Yes. So when that happens, then you just give it a few weeks and then you start seeing the permanent tooth coming through.
Okay.
So the gum will, of course, be red and fresh initially. Then it will turn to bright pink. Then it will turn to the dull pink like the other gum.
Yeah.
And then shortly thereafter, you have the permanent tooth coming through.
Okay, we have another call. Thank you for calling Health Check. What's your name and where are you calling from?
Hello.
How are you?
Yeah, I'm fine.
What's your name? Where are you calling from?
My name is Mark Murumba from Eldoret.
Thank you for calling. Thank you for calling.
Yes.
What's your question?
I wanted to ask.
Yes.
Yeah, this hydrogen peroxide, sometimes it is used in washing your mouth. Is it safe to use hydrogen peroxide to any age?
Good question. I think we find it in some rinses, gargling.
Yeah.
Yes. We'll respond to you. Thank you so much for calling from the home of champions.
Okay, thank you too.
Asante.
Yeah, the use of hydrogen peroxide has been used for various, it's a multi-used poly-used, multi-used kind of an element. So you find that sometimes it's used in whitening at certain concentrations and certain presentations. Sometimes it's used to remove disease in the mouth. So it's very good to clean the mouth, especially when we are handling patients with that's what you rightly said, mouthwash with gum disease, active gum disease.
Yes.
So hydrogen peroxide is very good in that because it bubbles and it has something called a superoxygen reaction that now kills off a lot of the bacteria that are causing gum disease. So yes, it is good for cleaning your teeth, but let it be a prescription. Don't use it routinely to do your day-to-day cleaning. So if a practitioner now recommends that you have it as part of your day-to-day routine, do it then up until he says stop or for the duration that you've been given.
An important part of this COVID-19 process, healing, and also just making sure that the virus is not, in your mouth.
Yeah.
Was that a recommended aspect of it all?
You see, the virus and where it stays is not something that you're going to control just by only doing good oral hygiene. There's more to it.
Okay.
All right. So there are other controls. The viral load is what is very important in terms of how to control. And a mouthwash really doesn't help there because the thing is multiplying in your system. It's not just out here superficially like you would now say for decay-causing bacteria. No, that one is a separate issue altogether because it's an aerosol produced and it is multiplying in your system and then going through droplets like your mucus, saliva, and other things. So the control of viral load is not by mouthwash. That's a whole different.
Okay.
If that was the case, then dentists will be the frontline guys dealing with the control.
But, Doctor, I got COVID.
Oh, really?
Yes,
Well,
it bit me. It came and it got me.
Well, you have a good immunity. That's a good advantage.
Thank God. Yeah. Thank you, Jesus, so much for preserving me. I knew I was going. I never even divided my things. I was going to give you something. The thing you gave me.
I hope the car keys.
Not the car. The car goes to my sister. Let's stop that joke. But one of the things that I was prescribed to, I had been prescribed to before after a proper cleaning by a dentist. It's like a pinkish, gargling thing. It's called something flex, something AX at the end. Hyphen Lex, something. Oh my, I forget. But it's like pinkish.
Yeah.
And
Androlex.
Androlex.
C.
Yeah. Oh, what was that helping with?
It's just a mouthwash, just to help reduce your
viral load.
No. No. Bacteria possibly causing throat infections.
Oh, so it had nothing to do with COVID?
No.
Okay.
That is just to control the throat.
Okay.
bacteria.
So yes, that's prescribed also. I got it after a thorough cleaning.
Okay.
I was not cheating on you as a dentist. It's
so.
with Hawa before.
Okay.
Yeah, first time I saw Hawa.
Okay.
Awesome. As you talk about that, I was asking, how do you take care of fluorine stain effect due to borehole water? Teeth are discolored brownish. Regards, Kevin. And we had spoken about this. Please go ahead.
I mean, with the
but let's make a call also, and then we go back to that. Okay. Sorry about that. Good evening. Thank you for calling. Health check. Hello.
Hello.
How are you? What's your name? Na uko wapi?
Mimi niko Kawaskari, naitwa Kevin.
Yes.
I wanted to ask a question about the tooth, Daktari.
Daktari?
Why the tooth breaks when it breaks halfway?
Why the tooth breaks?
In half.
The tooth is normally complete, especially the inner gums. But after some time, it breaks. It remains halfway.
Okay.
So I wanted to know what the cause is that.
Okay.
And whether it can be rectified.
Do you have a follow-up question?
So rectification.
Yeah.
All right. Fine. Thanks, Kevin.
Thank you, Kevin. Okay, let's respond.
Yeah. So when a tooth breaks halfway, most of the time the cause would be as a result of tooth decay. So the possibly was tooth decay that was ongoing quietly underneath, but we'll need to check. I'm just saying possibly.
Possibly.
Yeah, so there's a possibility there was tooth decay that was very quiet, there's no sensitivity or pain, and then suddenly tooth is breaking in half. And that's the same thing I get from patients who say, by the way, I was fine until I woke up one day, I was eating a piece of chip or soft food, and then my tooth just broke in half. So it has just weakened the structure over time. So there's basically a tooth like was supposed to, tooth is supposed to be like solid, like this pencil. and then you have some bacteria just getting in through a small hole and then digging out the tooth substance underneath, pole. So the day I just do this, the thing breaks in half, like the tooth would have.
Yes.
Because underneath there's nothing. So the solid structure underneath is no longer there. It's just this outside structure that is a thin shell. It's like an egg that doesn't have the inner components, like a boiled egg, and then you remove part of it.
And there's no yolk.
Yeah, there's no the white, and when you boil an egg and then it solidifies.
Yeah.
And,
Or the white is not there.
Yeah, so now there's no white. There's that part where when you tap the egg, it's solid. Then you get to the white part that is the
Empty.
bubble. Then you do this, it caves in.
Oh.
The same concept with tooth decay.
Okay.
So now when that happens, come in. Let's see how bad the structure destruction is,
Yes.
and then we can fill it up.
Absolutely. Please come in. Let's be seen. Charity is calling us from Meru Mugeni. Is that the Salamu? I hope I got it correct. Charity.
Yes.
Mugamono. Is that the Salamu?
Yes, but yangu ni kwenda.
Okay, awesome. Go ahead and ask your question.
Yes, my question is, I had my 2 canines. They never got out. The milk teeth. Hello?
We can hear you.
So they never got out.
But when I went for a scan, they found that the one that was permanent, it was vertical. Was it vertical or horizontal? It went horizontal. So the milk teeth didn't come out. So I'm asking, how can I have them? Maybe to remove the milk teeth and remove the canines that went horizontal.
Awesome. Are you comfortable sharing your age? I'm just curious. It's for me.
I'm 30.
When you said I'm dogo. Sawa. What to a third floor? Oh, yeah. Awesome. Let's just go to your question.
All right.
Yes,
so,
yes, thank
okay. So for her, it's one of the common teeth that tends to do that. So there's a way to do the correction, possibly with braces, but then we need to see how horizontal those canines are.
So wait first, are you going to have to remove the milk tooth?
Yeah, we'll remove, if we're to bring the canines in,
Yes.
thankfully the milk teeth are still there actually. Why? Is because it has preserved the bone in that area and the space for the
It's still there.
Yeah, the permanent canine. So we don't have to recreate space because teeth tend to drift in if there's an empty space. So thankfully the milk teeth canine are still there. So we can use the space that is there and maybe even improve on it. Then dependent on where those teeth are, we will figure out a way now to bring them out into the mouth, and then she'll have a permanent canines in. They are one of the most longest treatment duration teeth because they have long roots, and particularly if they have moved so far from where they should be to begin with. And from the sound of things, they're already too far. So we will just need to have a look at the scan and then see. So if you're taking up that treatment, it's one of those treatments that you just have to be patient because they take a while.
Yeah.
Yeah, to get those teeth corrected and put in the right position.
Okay.
Yeah. And sometimes we advise against it dependent on the position.
So she can stay with them like that?
Yeah.
Do they affect anything?
No, not at all. Particularly if you have the milk teeth in and they're okay, and the roots of the milk teeth are still fine, then we can bulk up the milk tooth to look like a canine, or sometimes we replace the milk teeth canines and put in something that looks like permanent canines.
That's my question.
Yeah.
What's the difference between a temporary, is it a temporary canine and a permanent canine? A milk canine?
Tooth. Yeah, the difference is basically the bulk.
Okay.
Yeah, the permanent canines are significantly bigger compared to the milk tooth canine. And you'll even see the size disparity between the permanent teeth and the milk teeth.
Awesome.
Yeah.
Did you respond to this? How to take care of fluoride stain?
I was going to. The fluoride staining will be taken care of dependent on the severity. I need to see the extent of that fluorosis staining.
Okay.
And then there are different ways. There are same-day techniques. There are others that will take multiple visits, just dependent on how bad the staining is.
Awesome. Someone is calling us from Kabete. My app says Lower Kabit Road. Kabit. Hi. Thank you for calling Health Check. Good evening. Hello, you're calling Health Check.
Hello.
How are you?
I'm very good.
What's your name and what's your question?
My name is Kimani from Kabete.
Awesome.
Yes, I have a question for Dr.
Sure, go ahead.
Now, my mzee is about 65 years old,
Uh-huh.
and I want to know what's the relationship between the tooth and the heart, because they're saying the tooth is affecting his heart condition.
Wow. Is there any other information you can give us about the tooth?
That's the only thing that I know, because actually the doctor said that he had to remove a few teeth.
Aha. Okay.
Yeah.
Do you have a follow-up question?
What heart condition?
They're saying it's about, I think his valves are closing or something like that. Like there's not enough blood going to his heart.
Okay.
Oh. I'm praying for him right now. Kimani, I'm praying for him just in my heart that
Thank
all
you so
will
much.
be well.
Yeah, it will be. Thank you.
Yes, but let's respond to that. Thank you for calling Health Check.
Thank you so much.
With the valve heart diseases, we don't want to have them having a constant state of inflammation. Constant state of inflammation in relation to teeth has to do with gum disease. So gum disease will cause the body to react and it's actually, gum disease is actually fueled by the immune system.
Wow.
So if you have active gum disease, then you have a constant state of inflammation which is occasioned by your immune system. So in that particular case, we want to control the gum disease that is being caused by dirt in the mouth, and we want to remove any decayed tooth, a badly decayed tooth that cannot be treated, so that we don't have the body having an immune reaction that is going to trigger now that valvular heart disease that is ongoing. So that is the relation between the tooth and the heart condition. We basically want to control an active immune process that is actually going to work against valvular heart diseases. Yeah, because they encourage issues again that are too technical to discuss, but there are issues that are related directly. So yeah, have him come in for a thorough clean, and then follow up with either an extraction of fillings or root canals for bad teeth, and then continue with your cardiologist in terms of the management of the heart condition.
Well, you just spoke about something I remembered, a question I wanted to ask earlier. People who have, like, when someone says they have a toothache, it's a direct sick off, because you cannot do anything when your tooth is hurting. Like, it's literally excruciating pain. What's up with that?
That's probably when now the decay has now arrived where the root canal is. Yeah, like
it was en route.
It was en route. Now it is where the nerves are down there, and that pain is bad. So I understand, because it will be referred to your head, to your ear, sometimes the side of the face, and you will have trouble opening your mouth, you will have trouble sitting, lying down, many things. Like you can't find a proper, pain relief is not being helped by drugs, or if it is a very short duration and then it hits again. You can't overdose, because then you're going to have ulcers acting up. So it's a bad thing. So, and sometimes the most common time it comes, it's at night when we are also at home sleeping. So we have to tell you, take painkillers, come the following day.
Yeah.
Or if you're at work, you're lucky because you can rush in and have emergency care.
But with this COVID, we're in a 24-hour economy. I think it's going to get there when everything opens up. Yeah. So are you thinking about that?
We hardly have any dentists at that.
I know. I'm like, we need to get there. We absolutely need to get there. We talk about what age is the best recommended for children to get braces.
As I've said, as long as you have teeth in the mouth, braces is a very broad topic.
Yes.
Yeah, so we have various types that will fit various ages.
That's true.
And there are various techniques that we can start training them, because even your teeth can be aligned by your tongue and cheek muscles. So by just having a child stopping, say, for example, thumb sucking, that can significantly improve the alignment of teeth.
Yeah.
If you have a child that has a habit of, pushing the tongue out, or airway that is blocked, we send them to the ENT. They correct that by removing tonsils, adenoids, and then we teach them how to breathe through their nose again. That child will recover without need for braces at all. But we need to catch that early.
Let's catch it early.
Yeah, if we catch it early, like anything else, then the child will develop super.
Absolutely agreed on that one. We've talked about what are some other general mouth and oral health diseases or disorders that children go through.
children will commonly undergo tooth decay.
Mhm.
That is the most common one.
And what
And
is tooth
then
decay?
Tooth decay is what, like I explained earlier. We have food, we have sugary foods.
Oh
we
yes,
have
the thing,
bacteria
that one,
that
the
forms
monster.
a cavity. Yes,
And
that forms a cavity, and then the cavity will end up. And now you see with kids, when you have a cavity that is ignored, they're the ones who will commonly show up with a swollen face.
Mm.
All right. So now when you're getting that point of a swollen face, that's bacteria that has really been there for a long time, because now you have that is just basically pus in there.
Oh no.
that
And
we
is that
need-
something we can see from outside? Like if someone says like they have a swollen side,
Yeah.
if they are, will you be able to see it?
Yeah.
Okay.
So it's sometimes very clear. Well, you need to pay attention, and maybe you know the person. But if, for example, I know your jawline, and then suddenly one side is skewed, and I'm like, that's not scary.
Mhm.
So then I know there's a need.
It would be accompanied by pain.
Yes, significant pain and throbbing, and sometimes even temperature change.
Oh,
The same child. So they'll have fever, they'll have restlessness, they'll have loss of appetite, among other things, and they'll complain of pain.
Yeah.
Literally, they won't sleep the whole night, so they'll be restless throughout the day.
Mhm.
So please get them attention as soon as you notice something in the mouth. And those regular
Absolutely.
checks sometimes help, because I understand that people have busy schedules. By the time you're seeing your child, they're ready for bed or they're ready for school.
Mhm.
And therefore, you don't have time to do those routine checks.
Yeah,
Yeah.
absolutely. Let's pick Patrick from Athi River. Thank you for calling Health Check. What's your question?
Hello,
Hi, how are you?
I'm very fine.
Karibu Health Check. What's your question, sir?
Yeah, my question is regarding the thumb sucking
Ehe.
of children.
Mhm.
Because I've had kids, my kids have had to go through wearing braces for their top teeth to come outward
Mhm.
because the top teeth were inward. And so wanted to know whether thumb sucking helps make the teeth better aligned, because then they never sucked their thumbs, all of them.
Mhm.
Yes.
Okay, okay.
So
He's saying that the children have grown up with their teeth inward, so they had to wear braces to kind of push them out. And so if some tucking habit would have helped.
He's quite
That's what
right
I
on that.
understood.
Yeah, he's quite right on that. And that's what I was even telling a patient today, that she came in with need for braces because she had a thumb sucking habit. But I told her that, the thumb sucking habit actually helped you better your facial appearance.
Mhm.
But that is not applicable across the board.
Mhm.
There are certain people who will do that and it will damage their teeth. There are certain people who will do that and it will damage their face, among other things. But there are others who it will actually help the thumb sucking habit. But then it has to come naturally with the child.
Mhm.
There are certain children I'll see and I'll tell them, stop that. There
Mhm.
are certain children I'll see and I'll just ignore and I'll be like, let me observe for
Yeah.
now, and then keep advancing, that need to stop when I see fit. Okay, so it's a very good balance if it is managed by a clinician.
Mhm.
But then if it is something that is outside of the clinical management, then I wouldn't say with guarantee that it will help.
Yeah.
But yes, there are incidences where it has accidentally been a good thing.
What could be, is that just a general genetic thing of how the teeth grew for his children?
Possibly.
Yeah.
Yeah. But there's a good part to play by environmental. That's why I was saying things like airway. So if the airway was bad, the tongue was wrongly positioned, the muscles are wrongly positioned, then yeah, that could happen.
Mhm.
Yeah. So there's genetics, minimal play, but most likely environmental.
Absolutely. We talked about decay. What are some of the other challenges? We talked about
Bad breath.
bad breath.
Yeah.
Any other challenges?
We also see with children beyond teeth. We see now the cleft lips and palates. Yeah,
Yes.
those ones are also there. And
How do those come about?
I mean, it's still being studied. Nobody has come up with a conclusion. I can't say that with conclusion. Maybe there's new research that I haven't read.
Mhm.
But as of when I was reading about it last, there's no direct correlation that we can say this is the cause. There are certain gene presentations that were being studied to see that if I see this gene, do I automatically see a cleft lip and palate, or a cleft lip, or just a cleft palate? It's dependent. So there's a variety of it as well. But those are some of the other challenges that we see in kids, the cleft lip and palates, and then those ones are now another whole segment to be managed, because feeding is a challenge, development is a challenge, and you know that when you manage those children with cleft lip, they are a lifelong management all the way until they're 18, because alignment is going to be hampered with, facial development is going to be hampered with. So those ones are going to be seen. There are other developmental issues that we also see, whereby teeth either don't form, like in kids that we have seen, they just didn't have the teeth jam. Like the tooth was just not there and is not going to be there.
It's not in the gum.
Yeah, it's not in the gum. And there are certain, there's even an Instagram account of one of those guys who doesn't have teeth at all, and he likes flexing his face. He likes taking his jaw forward.
Oh, that's funny.
Yeah, he likes taking his jaw and his tongue
Wait,
over
like
his
the
nose.
mask?
Yeah.
You know how the mask is?
Yeah, exactly. It's like taking his jaw forward and taking his jaw. So they're super flexible. But that's another whole disease process. It's a syndrome by itself.
Yeah.
So there are those ones who we just don't see any tooth development. So we need to see and then ascertain and say, okay, that's going to be an issue, but it's going to be coupled by these other issues, but this is how to manage, but they can develop normally. And we can now help them be societally acceptable, to avoid kids. You know, kids are really horrible when it comes to making fun.
I know. And, you know, you have to teach your children good manners, because that mapengo, you know, laughing at people, it's so bad.
So they can really ruin people's esteem.
Yeah.
So there's that.
So for that, how do you do it? You make a whole...
Yeah, so we actually can make for them dentures.
Yeah.
And they learn how to wear. But the challenge with kids' dentures is that they're developing. So you're always changing it.
Oh, yes. Oh, my.
Yeah, but we really need to. And even when you watch the series, there was this series that was very popular.
New Amsterdam?
No. The thing about monsters and kids. On
Ghostbusters?
No,
What?
Netflix. On Netflix.
Oh, what show?
I forget the name. But one of the kids there had that syndrome where he only had canines and was missing the other teeth.
Oh, no.
Yeah, so and was being made fun of, but he was happy with it. But, you know, he had friends at Buse.
Yeah.
I forget the name of the show.
Okay, we're going to find it and we're going to watch it.
But those are now some of the issues that we can manage also in kids. There are others that have teeth, yes, that are formed, but they're not well formed because either the mother was taking some medication that now interrupted the tooth formation.
Is that a thing?
Yeah, it is. Things like if you're taking tetracycline during the early stages of formation, that's the first trimester.
Yes.
There'll be discoloration of teeth, and they tend to have a blue discoloration, a serious blue discoloration.
Wow.
So now we have to deal with that again in
Okay.
kids. There's some that form teeth, but the teeth are not properly formed. They're so weak, so they break off easily as well.
So it's not like the teeth are coming off, they're breaking.
They're just breaking. You know, the slightest impact with food or something hard, they snap. Or they just chip away and stuff like that. So
Is that also because of disease, for example, like HIV?
Not really.
Any relation?
No. HIV kids can develop just fine.
Okay.
So that's why I'm saying it's not a direct correlation.
Okay.
Right. So there are those who also have weak teeth just because of what calcium was not enough during the formation, and then those are weak areas, and then we have to come and bulk it up. And we see it through. There are kids who have some serious allergies, and they're allergic to food, they're allergic to drugs, they're allergic to this, and also the teeth become weak. And those ones we are managing now throughout life, from the milk teeth all the way to their permanent teeth. So they end up with multiple crowns, but they live normal lives, and they have nice smiles and whatnot. Yeah.
Absolutely. I love it that today I learned, even as an adult, like, Uko, in your old age, you can still have your teeth because they are meant to last forever. I love that lesson. And also, the conversation really has been on oral health for children, but we ended up taking consultation for adults, and you're welcome because Health Check pays for you all your consultation. I have time for like 2 more questions, so you can make your call. You can call us. One is saying, thank you for a very informative show with Dr. Mutai. Please give us his contact. We said that you are at the Yaya Center on 3rd floor.
And phone number to call is 0711 279 035. That will get you through to the clinic.
Awesome.
Then we can make an appointment.
And
or just Google us.
Oh, yeah, you can Google Smart Studio.
Yeah, Google.
But 0711 279 035. Okay,
correct.
I was just trying to floss and then it just backfired on my face.
The first time you got it right. Though.
I did, yes. Thank you so much. As we talk about this, let's encourage them right now. What are some of the practices they must do? And number 1, we can't end the show without mentioning diet.
Yes.
Diet. What are some of the things that helps our teeth grow strong?
I mean, the sources of minerals that are present are, as I've said, they're abundant in the water to begin with. And now couple that with good nutrition, like you said. So if a child has a balanced diet, and the nutritionist can also help with this. You know,
I'm going to let you talk about the nutrition. Can I pick Jane from Nakuru?
Go ahead.
But we're not losing that. Thank you, sir. Jane in Naks, how are you?
Hello.
Hi, Jane. Thanks for calling Health Check.
Yes.
What is your question?
My question is there a permanent solution for teeth sensitivity? Yes.
You have a follow-up?
Hello?
Yeah. Are they multiple teeth or just a few isolated ones?
All of them.
Okay. All right.
Okay, Jane, thank you for calling. We have your question and we'll be responding shortly.
All right.
Thank you. Awesome. Let's pick up one more call before we get back and then just respond to all that as we wrap up this episode of Health Check. Thank you for watching Hope TV, where you look and live a great conversation on our oral health, which is so, so important. We have a responsibility to take care of our teeth, to understand our gums. Like after going to see Daktari here, I got to know that I have a very small gum and my teeth are in jaw. Oh, jaw. Okay, wait.
What gum?
Jaw. What's a gum? The gum is not on the jaw?
It's on the jaw, but yeah, it's not small gum, small jaw.
Okay,
Your
so
gums
it's a
are fine.
small jaw.
Good.
Big teeth.
No.
I don't know.
The teeth
That's the
are
best I can
fine.
explain it.
Let's talk about the jaw.
Okay, so I have a relatively smaller jaw than an average 30-year-old. And so understanding that reminds me to, even when I'm tired after this show, when I get home, sometimes I just want to remove my makeup, shower, and get to bed because I'm up at 4 again for, of course, Hope FM. That's Activate. And so I'm tempted sometimes to just, mouthwash and go to bed. But I'm like, there's a monster waiting for me to not brush. They're just like, terrible people.
Yeah.
Anyway, let's respond to that. I will have time for one more question after this. I have a text also. Daktari will respond to both as we finish up on our diet and what it actually means to have a balanced diet. Hello, my 3-year-old child's teeth have incomplete enamel and easily break. What could be the problem and how can I manage her, please? Will the permanent teeth form the same way?
Okay, so I'll answer the first one from Jane, the permanent solution for teeth sensitivity. I need to see, because she's saying it's a generalized thing. Most of the teeth sensitivity we see around the premolar molar area.
Yes.
And then those ones are tend to have different sources. So you might find either it's a chipped part that is on multiple teeth that we just need to cover up, and then that will sort out the sensitivity significantly. Sometimes we'll advise you that you can use the Sensodynes and the Colgate Pro Sensitive, among other desensitizing toothpastes, and that will also help with it significantly. But I need to see to ascertain what is the cause, and then I will advise best. But then that can also be coupled with other issues that are also ongoing behind the scenes. That's why I'm saying, like, nowadays we're realizing the mouth is just not an isolation by itself. It is connected to the body because that's what's carrying it to begin with. So there are certain symptoms that will come through your mouth presentation. So once we sort out the other issues, then we work backwards essentially. And then that will help with the permanent solution that she's seeking. The 3-year-old with the incomplete enamel as described, I need to see, because as I've said, developmental issues tend to target children at an early age. Now, the congenital malformations of teeth with parents and other congenital issues are tend to stress them because of that lack of information, because what is the norm is popular, and then these congenital malformations are happening in isolated cases. So there's no public awareness about it. So in such situations, the dentist is your friend, and there are pediatric dentists all over this country that can really, really boost that child's oral health significantly. The dental school in Nairobi University and University of Nairobi and Moi University in Eldoret have very good clinicians who can manage such cases at a very fair cost. And they will push it to the master students who will probably have a better understanding of these cases. And there are other pediatric dentists also in Nairobi, Nakuru, and other parts that are able to, with sufficient, I think, finances, you can consult, and they will also be able to manage the same cases. Even Kenyatta Hospital, Nakuru referral, I don't know where she was calling from, but yeah.
This one was actually a message, and they didn't say where they are.
Yeah, so if they can maybe pinpoint to us the location, we can also refer them to a pediatric dentist that is able to assist.
Absolutely. Thank you for that, Dr. We were still on the part of what can we do with our diet. I think it's time for me to close that call line.
Yeah, in terms of diet, remember teeth formation starts right in the womb. So as a mother, when you're undergoing the period of pregnancy, particularly the formative trimesters, that's being the first and the second, you really need to pay attention to your diet, where you have a calcium-rich diet. That's why you have the supplements that you're given, and then avoid things that might ruin it, like medicine that you take because of disease that you can avoid. Please avoid, and strictly follow the advice of your clinicians, that being the dentist and the medical team. And then once that stage is done, and then you have the first 7 years of a child's life, that's the next part that also you need to be very cautious about, whereby you're feeding them without calcium-rich diet, and you're giving them fiber, and just a normal balanced diet will just transition those children from milk to permanent teeth that are really healthy. And you see that a lot with, especially if you're avoiding this fluoride-rich water, the hard waters. So people are now taking up reverse osmosis to help now control the fluoride in the water. So if you take your child through that program, just first 7 years of life is very important. And then also pregnancy, very important. So even during that period where you're nursing, as a mother, remember whatever you're taking is coming through your milk. So that is going to affect the child, and that is during the first 7 years of life. So be cautious during the nursing stage, during the pregnancy stage as a mother, then the weaning stage as you're introducing now solid foods to the child outside of milk, and then the first 7 years of life where they're able to even eat and carry whatever food they're taking to school and back. Yeah, so that's what I'd advise in terms of the dietary requirements.
Absolutely. Please, everything in our body has to deal with, everything we eat has to deal with just our general health. So it's very, very important. I know carrots for eyes, fish for brain. What is for teeth?
There's a popular myth of milk, but
calcium-rich. I threw that in there. And what if, lactose intolerant people?
That's rare, especially in the young generation. Lactose intolerance comes
when you're
but it exists. And not to say that there are kids there are those ones, as I've said, who are generally allergic to stuff. There are calcium supplements that exist.
Absolutely.
That are lactose-free. Yeah.
Get them and live. Hi, it's Dan from Dagoretti. My dad is 70 years old and has very loose teeth. He has been losing one by one over the years. He's remaining with 3. What do we do? Because he cannot chew majority of healthy foods.
At that stage, that's severe gum disease. And that's what I say about gum disease. They can clear your teeth in a span of 2 years. 32 teeth can fall off in 2 years or even less, particularly gum disease coupled with diabetes. So once you have that combination, it's a downhill track for your teeth. So what you can do for him, the 3 teeth need to be assessed, and then we see if they can be saved and the gum disease controlled. And thereafter, we can fabricate now teeth replacement options for him. We have fixed ones and we have removable. He can have dentures done and he'll be able to chew just fine. And he'll restore his even facial structure. He'll look even younger at 70 because
your whole jaw kind of falls.
Yeah, basically your face is dished in. So
is it your jaw that falls? I was going to say your gum, then I remembered correction.
Good teacher.
Good student.
Good teacher.
Good student. As we talk about that, so can you come and see you? He's in Dagoretti. Dagoretti is just here.
Yeah.
Come to Smile Studio at Yaya. Get to see Dr. and see what you can do about it. So you're going to get dentures?
Most likely, yes. Yeah. But we're definitely going to have like a full mouth restoration of missing teeth.
Yeah, let him enjoy, this season. And God has given him really good years. 70 years is a really, really good age. I want to thank you guys for watching so much. As we wrap up on the overall health, we've highlighted a few things.
Yeah.
But are there any other things you'd like to highlight? I think we've even talked about the correlation between your mouth and your heart.
Yes. and airway. That's an important thing.
Can we talk about self-confidence just for like half a second?
Yeah, we can. I mean, as you said when you started the show, what you wear, your smile.
Yeah.
Yeah, so smile is definitely a big contributor to people and their confidence. People will come in for correction of their teeth in their adulthood because parents couldn't afford, but they have been troubled by the same for life.
Yeah.
And once that is corrected, the confidence is really boosted and people are coming out even stronger than they should have. Yeah, without the correction.
Yeah.
So self-esteem, confidence plays a big role because what people see, what people easily pick out is a skewed smile. And that's why some people have photos of, I don't know if you've seen this Instagram or social media picture that has one shaved eyebrow and then they've put a missing tooth. The guy is smiling and there's a missing tooth and then everyone is commenting about the missing tooth.
Yeah.
And then someone says, has anyone noticed the missing eyebrow?
Yeah, that's
Right,
true.
so that's the thing.
That's so true.
Yeah, so that goes to show you about the importance of a smile. So if you have those confidence issues, there are certain things, and please understand that oral health is a journey. It's not just a one pit stop where you come in and you're sorted and off you go. And there are various methods to address different issues.
That's why your dentist should be your friend.
Yeah, should be your friend, and then we'll customize according to need. And once that customization happens, then I think satisfaction will follow easily. And then confidence is automatic. Yeah.
I can tell you he's very thorough. Like he literally goes to you, he's like, so I just want to move this a bit so that this part of your face can go like this. And then this one will go like this. And then, even me, I have work to be done. And it was like, oh my God, Kerry, your smile. I'm like, bado kuna kazi.
Yeah, it's true.
This dude I met wanted to give me full disclosure. And one of the things he did is like, just as we get to know each other, I had an accident a while back. And then he just removed his dent. I was like, oh, it's okay.
They need love too.
Everybody needs love. As we wrap it up, it's so important, and I cannot highlight this any further for you to do your cleaning. If you can brush 3 times a day, Dr. says you're welcome to do that.
Even 5.
Even 5 times.
Yeah,
as often
floss.
as you can.
Yeah, as often as you can.
And Kenyans, let's floss. Let's learn how to floss. Is it affordable floss? I find floss a bit expensive. Like when I'm like just shopping and I'm like, oh yeah, I need to top up my floss. I'm like, acha tuishe kwanza.
Well, I think I've seen the cheapest ones being 200, but then they stay a
It is a long time. That's true. That's true. Over 6 months.
It's about it's 400 meters. That's like,
you just need like
an Olympic track. You can imagine a string that is an Olympic track.
Okay,
it's 400 meters.
It's worth it.
It's worth it for 200 shillings.
Yeah. Absolutely. And also it has like some freshness as you do that. Dr. Wrap it up. Encourage parents even as we conclude on just the steps that you've taken us through just as a wrap up.
Parents, bring your kids to the dentist. Parents, brush your children's teeth. They need close supervision of brushing. A child does not develop neuromuscular control to enable them to do meticulous brushing up until the age of 7. So do not assume that because they're able to hold a toothbrush and walk to a sink and brush their teeth, they've done a good job. Supervise the toothbrushing from as early as when they can and to as late as 7. From about the age of 7, you can start letting go. But that supervision has to be there. Because even giving them a needle and a thread and asking them to to thread a needle, and you see the difficulty there. Now imagine something they can't see in the mouth and what they don't understand.
Yeah, it's so complicated.
Yeah. So just supervise that toothbrushing and don't give them that independence until they're 7. So make it your due diligence and it will save you a ton of bills and frequent visits to the hospital. So the time you're saving running to work is what you're going to waste coming to see me. And I would not let you go, and that will be for many years to come.
Wow.
So yeah, those are going to be hours spent. So please do supervise that toothbrushing all the way until 7 years.
Thank you so much, David Atundo, for watching from Buruburu. There's a baby called Amara. I love to buy her some, Kinder Joys and stuff like that. All my babies, Jason, all of them. What did you say about that?
If you want to give them sugary snacks, please try and limit them to within food, the main meal. So the lunches are not dinner, by the way, because when they're eating dinner, they're going to bed. So you want them to have as minimal a sugar load in their teeth or mouth during the period where they're sleeping. because saliva production goes down and tooth decay is really rampant at night, not
Mhm.
during the day. So if you have to give them those snacks, localize them to immediately after a main meal, like say lunch or say an 11 o'clock snack. That's
Absolutely.
it. And then follow it up with tons of water drinking. And if they can do their brushing immediately after, even better.
Okay,
Yeah.
so let's give them just a little candy. It's good for their heart and it makes them happy. As we wrap up, we have like 20 seconds, Dr. Riam. So you want to say, my teeth are loose, 6 are shaking. What do I do? No cavity.
How old?
Come and see the doctor.
Yeah, because that's
Give your
most-
contacts or whatever. Thank you for the answer. I need doctor's contacts, please. One more time.
0711 279 035.
Or visit Yaya Center.
Or Google us.
Google
Studio.
Smile Studio. Just
Yeah,
Google
you'll
that.
You'll get our contacts.
And even if you want to Google Smile Studio, they'll tell you how they're dealing with scaling to this time of COVID-19. Thank you so much for watching Health Check. That's all the time we have. Remember, News Watch at the top of the hour coming through for you. But also, Chiriku right here on Hope TV, where you look and live. I'll see you tomorrow morning on Hope FM. This is where you listen and live. We have Team Worship Wednesday, my favorite day of the week. I'll see you there.